Alice.
Hi.
My name's Teresa. I'm a nurse practitioner.
Hey, Teresa.
I'm going to be doing your visit today. So just tell me, what brings you to my clinic today?
Well, I was gonna go up later on today to my HIV doctor anyway, but I thought I'd make an appointment with you because my OBGYN wouldn't give me my prescription for my birth control pills, and I really need
Some type of
some kind of-
contraception?
yes, ma'am.
Okay. Tell me, are you a smoker?
I am. I don't know why he said something about me being 35.
Okay, alrighty. So I can explain to you what his thought process
Okay,
is.
please.
And just other couple questions about the smoking. How long have you been smoking?
I don't know, since I was a teenager.
Okay. And how many cigarettes do you smoke per day?
I'd say a pack.
Approximately.
A pack.
About, okay.
Yeah.
On a scale of 1 to 10, 10 meaning you can't wait to quit, what number, where would you be at of that interest of quitting?
I'm trying really, really hard to quit doing unhealthy things to
Okay.
my body.
Okay.
You know? So, because I do use, I'm addicted to pain pills.
Okay.
And take them intravenously and trying to stop that. So stopping smoking I think would be a help.
Okay.
I'm trying to, so maybe like a 5 right now.
Okay, so you're thinking about it,
Yes,
but you're
ma'am.
not quite there yet.
Yes, ma'am.
Okay, great. Well, we now know from a lot of research that women who are 35 years of age or older and smoke and want to take some kind of hormonal contraception such as pills, something called a patch or NuvaRing, anything with estrogen and progestin in it, especially the estrogen, can increase your risk of blood clots and even heart problems.
Oh, okay.
So I bet that's what his thought processes were.
Okay.
That you're 35, you smoke, you shouldn't be on the pill anymore.
Okay.
But there are other alternatives, and we can talk about that. So, are you aware of any other methods of birth control?
Yeah, I mean, I know that people, I know they've got things inside of them, and, I just don't.
Like IUDs,
Is that what they're
intrauterine
called?
divorce, yeah, a device they go up into the
Oh.
uterus. Forget that.
No.
Okay.
Can't
Or
do
there's
that.
an implant and goes in the
No,
arm.
no,
That's
no,
called
no.
Nexplant. So
No.
you're not interested
That's
in any
just
of that.
totally, I
Okay.
don't want to put anything foreign in my
Okay.
body.
Are you aware of condoms and
Oh.
diaphragms?
Oh, yes,
Okay, alrighty. There's even over-the-counter sponge. It's called a Today sponge, which has spermicide in it, and that can also help prevent pregnancy, especially when it's used with condoms. But there's also another option, and that's called Depo-Provera. Have you heard of Depo? Okay. Depo is an injection that it just goes in your arm, and it's every 12 weeks.
Okay.
So you'd be coming in here every 12 weeks for an injection of Depo-Provera.
Okay.
And why you would be a candidate for Depo-Provera is because even though you smoke and you're 35, Depo-Provera has no estrogen in it.
All right.
It has a
Okay.
hormone called progestin, but that's safe to be used in a 35-year-old who smokes.
All right.
Okay? So I think that's a viable option if you want to consider that.
Sure.
Okay, all right. Just another couple questions, and that is, how many times have you been pregnant?
Twice.
Twice, and you have 2 living?
I do. Yes,
Okay,
ma'am.
alrighty. And tell me from the standpoint of your current sexual partner, you've been with him for how long?
A long time.
Okay.
He has HIV too.
Okay.
So we don't usually use condoms.
Okay.
Then, but sometimes, like a few weeks ago, I got high with somebody I know, and we had unprotected sex. So that was scary.
Okay. And that was a
and
new partner?
Yes, and that was embarrassing and scary. And,
Okay.
when I
Well,
do
sometimes
these
we all
things.
make, some decisions out that aren't always in our healthy best interest, so don't beat yourself up about that. However, we're going to go forward.
Okay.
Okay?
Thank you.
You're welcome. So, sounds like maybe you're interested in Depo. So I just want to ask you a couple other questions. When was the first day of your last menstrual period?
It was about 6 weeks ago.
Okay, all right.
I've always had irregular periods.
Even while you're on the pill,
Mhm.
they were irregular?
Mhm.
Alrighty. And when did you have the unprotected intercourse with your new partner?
It was a couple of weeks.
A couple
ago.
weeks ago. Have you happened to have done a home pregnancy test?
I did. It was negative, and it was a couple of days ago.
Okay.
God.
Okay.
Yeah, I don't need any more
Okay,
kids.
alrighty. So, from the standpoint of explaining side effects to Depo, I just want you to be aware of a couple pretty normal side effects to Depo.
Okay.
And that is irregular bleeding. You're kind of used to irregular bleeding.
Sure.
That can happen especially when you start Depo-Provera.
Mhm.
We call it breakthrough bleeding. And it can happen especially through the first 2 injections, which is 6 months of Depo. However, usually after that second shot, you get to the point of not having any periods. And that's normal too. So you go from
Okay.
irregular spotting to no periods.
Okay.
It's all normal for Depo, okay? The other thing that I've seen in patients on Depo is sometimes there can be weight gain, maybe like 10 pounds in a year. Some women don't have any weight gain at all. I just want you to be aware of that.
Okay.
Okay? Did you have any questions about that?
I don't think
No?
so.
Still interested in Depo?
Sure.
Okay, alrighty. And when was your last pap smear?
It was in the last year.
Okay, and have all your pap smears been normal?
They have.
Okay, and when was the last time you had STD testing?
Oh gosh, I have to do it a lot. So.
Okay,
In
alrighty.
the last year.
Okay, so let me recap what I'm hearing.
Yes, ma'am.
1 is you're interested in Depo.
Mm-hmm.
2 is that you've had unprotected intercourse 2 weeks ago. However,
Mhm.
you had negative home pregnancy test a few days ago. And your last period was 6 weeks ago. And you had stopped the pill how long ago?
A few months ago.
A few months ago, okay. So this is what my recommendation would be. Today, let's get a urine test and we can check, make sure you're not pregnant because it's been 2 weeks since your last intercourse that was
Okay.
unprotected. So we'll get an EPT or UPT today. And how about if we do STD testing off of the urine?
Sure.
Okay, just to
Sure.
make sure everything's all right. Now, let's try the Depo. However, I will let you know that if in the future you do stop smoking, we can revisit all the other different methods of birth control. Okay? Just kind of think about that.
Uh-huh.
When you get ready to be interested in stop smoking, please come back and see me because there's things that I can suggest to
Do I
help you
have to stop smoking completely or just cut it way back?
completely.
Okay.
Yeah, so you have to really be ready and make that commitment and then stop smoking.
All right.
Okay? So that can be an incentive for maybe other types of birth control.
Okay.
And it'd save you money. Okay? Because I know cigarettes are expensive.
Yeah,
so-
that's true.
Yeah, right. Okay. So do you have any other questions for me?
I don't think so. This has been really, really informative.
Good,
Thank
good.
you.
I'm glad. So I'm going to show you where the bathroom is.
Okay.
And then get me a urine test and we'll do all the tests off of it.
Yes, ma'am.
Okay?
Let's
All
do
righty.
it.
Nice to meet you.
Thank you. Nice to meet you
You're
too.
welcome.